So the next speaker is Dr. Erica Edfort. Dr. Edfort is a seasoned healthcare professional offering 30 plus years of progressive leadership experience, along with education. And she is currently an assistant professor of nursing at Chamberlain University College of Nursing. Dr. Edfort is a fellow with the American Stroke Association for her work in the field of stroke. She has worked at several acute care hospitals, preparing them for the stroke center designation, and provided education on the care of the stroke patient to nursing staff, medical staff, patients, families, and community members. Dr. Edfort has presented her stroke research at numerous local, regional, and international conferences. And indeed, today, the title of her presentation is A Guide for Acute Stroke, Evaluation of New Jersey's Practices.
Good afternoon. Care of the acute stroke patient requires management of care across multiple disciplines. Lack of adherence of established protocols for acute ischemic stroke, it has been identified as being having a significant effect on the outcomes of care. The purpose of this study was to determine the effectiveness of the processes that were currently being followed in 2010 in the state of New Jersey acute care hospitals. Lack of the available literature providing evidence of prior practices for stroke care in the state of New Jersey precluded my being able to compare current practices with anything that was done previously. There was also a lack of literature on statewide guideline compliance for acute stroke anywhere else in the United States. What I was able to find when I had done my literature search was a study conducted on the stroke belt, the southeastern United States. I used that as a guideline. However, that study only looked at TPA rates. I was looking at additional care practices, so I went a little farther with my study. It had been determined that to rectify the situation, we must have a solid understanding of the problem, the target group, and any obstacles that cultivate strategies enabling change. What I had done was I utilized a convenient sample of stroke healthcare professionals within the state of New Jersey. I was one of the founding members of the New Jersey Stroke Coordinators Consortium. The consortium consisted of stroke nurses, advanced practice nurses, program managers, and administrators, as well as data abstractors. And what I was doing was I was looking at the provider practices and compliant with the stroke guidelines for care. The guidelines were established by the Joint Commission and the Brain Attack Coalition. I looked to determine the stroke healthcare professionals' perceptions of care. And I also determined their satisfaction levels with their facilities' compliance with the guidelines. There were 79 participants in my study. I got a 70% return rate on the survey, which was considered a very good return rate. I had sent letters of invitation to all acute care hospitals in the state of New Jersey that were following a process for the care of the acute stroke patient. I received this information from the members of the consortium. There were 42 hospitals designated by New Jersey's Department of Health and Senior Services and the Joint Commission as primary stroke centers. Of those 42, 12 of them were comprehensive stroke centers. There were 15 hospitals without designation at the time that I conducted my study. I utilized Donna Bedian's quality health outcome model as a framework to investigate not only the compliance with the guidelines, but also effectiveness on the outcomes, the interventions, and the healthcare practices. As you could see, my adopted model on the right-hand side looked at each of the different types of hospitals. It looked at the different classification of the caregiver as well. The results that were identified in a way were understandable, but some of them were a little surprising. Both the certified and the non-certified stroke centers identified lack of technological support as being their main issue that impeded the effectiveness of them performing their roles. The certified stroke centers identified lack of knowledge of the stroke healthcare professional's role as an issue that impeded their effectiveness. They didn't know exactly what they were supposed to do. There were no guidelines as far as what a stroke nurse at that point in time was required to do. The non-certified hospitals, they considered lack of hospital administrative support as their second issue impeding the effectiveness of performing their duties. When I looked at the core measure compliance, what I had done was I used a 30-day pre and post survey. I had looked at all of the stroke core measures, which are listed on the screen. It was identified that several of them were falling below the benchmark in the 70th percentile. And this was concerning because it's already identified that if the measure is not documented, it's considered as not being done. So this is something that I was interested in to find out, was it a documentation issue that was causing these measures to fall below benchmark? The respondents in the study voiced similar concerns, stating that the issues that plagued the stroke healthcare professional consisted of a lack of documentation. They also identified TPA rates. Now, the lack of documentation has been an ongoing issue over the past several years, and it was identified that improvement with guideline compliance also was an issue. Each facility should be aware of its own individual deficiencies, and they should be implementing some sort of process improvement plan to address the deficiencies. Compliance with the stroke guidelines revealed hospitals certified and those that were not certified followed the protocols and recommendations for care about 87% of the time, and this again was still below benchmark. What was identified was that many of the facilities realized that they needed to make some change, but they really weren't understanding what needed to be done or how to do it. What was I looking to do next? Well, the study investigated the perceptions of stroke care for the stroke healthcare providers, and it was identified that the lack of documentation was a major reason affecting the outcomes of care. I had also identified the need for a quality improvement activity for managing the core measure compliance. It was also identified mentoring and education of the staff was also a major issue. What I identified was that advanced practice nurses as frontline staff, and many facilities utilized advanced practice nurses at this time, they're not always called upon to address compliance issues with stroke care. Utilizing advanced practice nurses to assist with the requirements of the protocol documentation and initiation of the care protocols may increase guideline compliance. In 2017, there was a second statewide study done that actually was conducted utilizing the results of my study. The recommendations in the 2017 study were in an effort to improve stroke core measure compliance. The researcher in that study, Dr. Varsha Singh, again was one of the founding members of the New Jersey Stroke Coordinators Consortium, just like I was, and she identified the necessity of educating advanced practice nurses in the stroke core measures, what they need to do to help the stroke nurses manage the care. Since the advanced practice nurses are on the front lines in many of the acute care facilities, they also have prescribing capabilities with many of the staff nurses the stroke nurses may not have. Having a provider on the front lines in both the emergency room as well as a hospital staff member would enable the stroke measures to be instituted at the first sign of stroke symptoms or on the patient's initial arrival in the emergency department. Dr. Singh developed an educational program that had been provided to several hospitals in the state. The advanced practice nurses that participated in her educational process gained an understanding of what was needed assisted with guideline compliance for the acute stroke patient and the care that they required. Advanced practice nurses Completing an educational process that Dr. Singh had developed helped them to also increase an understanding of the requirements of stroke care, which in the end leads to levels of increased compliance. The advanced practice nurses that participated in Dr. Singh's study did identify an increase in knowledge and comfort caring for the acute stroke patient. As of now, I have worked with Dr. Singh to combine our two studies, and this third study has been presented at numerous local, regional, national, and international conferences in the past year to year and a half. Dr. Singh and I would both like to publish our combined study, and we are currently investigating several of the journals to see which one would be best suited for our research. If anyone has any questions, I have listed my contact information on the screen. I thank you very much, and I hope you enjoyed the presentation.